majority of people still either have no symptoms or have very, very small, very minor symptoms. And I'm hoping that that will be true with the President and the First Lady as well. It may very well end up being the case. And the fact that Hope Hicks had symptoms, though, makes me concerned that this is actually real, that these are real cases. And another point I want to make that Cliff Jenkins just pointed out, you know, it's not just one test. I mean, the Chief of Staff is testing negative, but of course he's going to be retested, and we have to continue to be vigilant on anyone that's around the President.
So the way I understand it, Dr. Siegel, there's been so many nuances and different definitions of this virus. You could have it, but you could test negative for it, because it takes about 3 days once you get it to test positive for it. And once you answer that, I'm just wondering about the test itself. When you go to the White House to interview the President, as you did, you get that rapid test. You know in 15 minutes whether you're positive or not, and you go forward or you go home. The President gets that every day. I'm wondering, he said to Sean, I got a test, I'm waiting. That can't be the 15-minute test. It's got to be, do you think he possibly had the 15-minute test? They said it's 80% positive, 80% accurate, and then one for an additional test?
I think that that's probably true. He probably had what we call the PCR test, the nasopharyngeal swab, the more invasive test is probably what he had. And I think, given again that Hope Hicks had symptoms, that this result is real. And I think also that the First Lady tested positive. But again, the fact that he's asymptomatic is a really good sign. But we have to watch that very, very closely over the next several days. And there's no question in my mind, by the way, Brian, he can perform his duties 100%. No symptoms. That's not even an issue on the table here.
Okay, so what we do know about Hope Hicks, and she tested positively, and the news was broken by Bloomberg first, before the President and First Lady were typically, and there's a picture, stock picture from a while back. Typically, Dr. Siegel, the symptoms appear after about 5 days. Can be as early as 2, can be as late as 14 as well. So what people are going to start to do is they're going to try to do reverse contact tracing on her from what is known of her personal schedule, and etc. As Ainsley said, she was traveling with the President a couple of days ago and went to some rallies and things like that. So is that how you figure out where it came from, or does it even matter?
Steve, what you just said means that the CDC is probably going to hire you, because you got that exactly right. And listen, when this news first broke at 1 a.m., everyone was saying, well, Hope Hicks was on Air Force One with the President and the First Lady on Wednesday. And, look, on Air Force One, I want to point out, all planes have HEPA filters, which are excellent at filtering out viruses like 95% of the time. But you're still in close quarters on a plane.
We've got a lot of pictures of Hope Hicks.
Ventilation like you would outdoors.
And Dr. Siegel?
Must be Air Force One, but it probably wasn't, because it was too quick.
She's a social butterfly, out and about. That's how she got it.
Also point out that apparently when she was traveling,
Shaking hands and hugging people.
Air Force One, she was feeling poorly, and so they kind of, they
should have known better.
her on the plane.
It's in close proximity to the President.
Yeah, that's good. Yeah.
All right, so will he have to stay, he'll obviously stay in quarantine, he's doing that. How long does he have to stay in quarantine? I've heard 10 days, I've heard 14 days, because the first debate, he says he tested positive last night, that's October 1st. First debate is October 15th down in Miami. I mean, the second debate, sorry.
Ainsley, I think the reason for the confusion is because originally the CDC said 14 days, but over time they started to test that and change it, and the number became 10 days, 10 days total. But what we like to see is 2 negative tests. So if the President continues to feel well, somewhere around day 6 or 7, he'll get a test, and then he'll get another test, and then he'll be able to go back. I think 10 days is the magic number here. In the cases of people returning to work, by the way, sometimes we'll cut it as short as 7 days from diagnosis. But of course, we're going to be ultra careful here with the President, so I think it'll be 10 days.
And of course, you can't forget about the First Lady testing positive, Dr. Siegel, too. But she's in such fine shape, and you're younger. You focus more on the President, especially because of the position. Well, let me ask something. So he's your patient. He tests positive.
Well, she don't need McDonald's, I don't think. A fine-looking lady at her age.
Do you give him this steroid cocktail that people are talking about? Do you give him, just recommend zinc or vitamin D? How do you treat him if he comes
The
into
president,
office
on the
and
other hand, is a little overweight,
Really excellent
or as
question.
CNN would say, morbidly
What
obese.
you made about zinc and vitamin D, I do think those are both good ideas. I think that they're pretty much harmless, so I would consider that. Remdesivir is working, but it's not something we would give to somebody that's asymptomatic, even the president. And the steroid dexamethasone we're using later in the game when people are already hospitalized, so that's not going to be given to them. But, you know, the thing that's really interesting here is monoclonal antibodies. We're almost getting to the point where we can use these antibodies against the virus, against the spike protein of the virus, right at the beginning before people
whose
get
antibodies?
sick.
Your own?
No, that's plasma, like yours or mine, that somebody that recovered. I'm talking about synthetic, made in the lab, synthetic antibodies. There's 2 studies out over the past week that show they work very well, even in mildly symptomatic or asymptomatic patients. But it's still not there yet. I'm looking down the road for that. I don't think that he's going to get that either if he remains asymptomatic.
You know, and Brian was talking about some of the therapeutics out there. Famously, the president revealed that in the spring, after one of the ballets at the White House,